My earliest memory is when I was 3 and my younger brother was 1, and we were at a lake with my entire family for New Year's. My next memory is a helicopter coming down, and I remember it was really loud and got alarmingly close to me. I didn't really ask questions. I was a really shy kid, and I still didn't even know what the helicopter was doing or why it was there, and I didn't see my brother go in it. The next memory that I have is at the hospital. It turns out he had walked into the lake and had been underwater for quite some time. He was diagnosed with cerebral palsy because he had pretty severe brain damage, so he couldn't walk or talk at that point. My mom immediately started trying to find a treatment for him. So she took my brother to China and she tried a bunch of different things, naturopathic medicines and things like that, but ultimately found that the best potential solution would be to find an umbilical cord blood match. But we couldn't find a match, and it's usually really difficult to find one if you're a person of color or mixed race. And then when he was 19, he passed away. That was sort of due to complications with pneumonia and cerebral palsy. At that point, I was really moved to found Anja Health in his memory, so named after him. Current data shows that 1 in 16 children can benefit from stem cells before they turn 18. However, most people don't have access to their own cord blood stem cells, largely because they don't even know that this is an option. So I know that you banked for your kids, and I was wondering, why did you bank for your kids? What was it that was communicated to you that made you optimistic about the future of cord blood and placenta and cord tissue stem cells?
My daughter's 9 years old, so I don't think the science was nearly where it was then as it is now, but we make breakthroughs at a faster and faster pace, kind of like Moore's Law. That's why it's important where you need to have stem cells on hand because, 10 years, the sky's the limit in terms of what you can and cannot do with it.
In 2012, it was published that someone had reversed their type 1 diabetes using cord blood stem cells. And in 2018, we learned that a son in a family had leukemia and was able to go into remission after using his sister's umbilical cord and placenta stem cells. And in 2022, the first person ever used umbilical cord blood to help cure their HIV. And there are so many other diseases that cord blood stem cells have been effective for, like sickle cell anemia, other types of cancers, heart disease, liver disease, even treating social anxiety in children with autism. What's amazing about stem cell science is that today, the FDA has approved stem cell treatments for 85 diseases. But a little over 10 years ago, this number was 0. So you can only imagine what will happen over the course of the next 10 years and the following years after that. You only get one chance to save these stem cells, and we are working to make sure that every family has this opportunity.